Veterans Day is on Monday, and it's a perfect opportunity just to explain a little bit about the services that we provide and how we work together with the community partners. So we, as a group, there's 6 of us. So we have a coordinator, his name's Brendan Richards. He's sitting right here with us today. He's located down at Camp Johnson, which is our main hub. We're spread throughout the state. We're called the Family Assistance Centers. So we fall under the family programs umbrella as a whole. There's many programs under that umbrella, and I'll explain more about that later. And I can also send these slides out if anybody's interested in them after this today. So this is just an overview of what we provide for assistance and the umbrella that we fall under for family programs. We prepare and support service members so they can be ready for times of deployment, difficult times, to meet the goals and empower families as they handle the challenges of everyday life with being as a part of the military. What is a family assistance? That's what I do. So basically, we are a big resource and referral hub for the communities that we are embedded in. So we educate ourselves to what each and every one of you are doing for the service members and their families if they were ever to come to us for help. We're basically a one-stop shop, so they don't have to call all around the communities. You know, they're already under stress. They already have a lot of things going on. We want to make it less hectic and less stressful on them. So we educate ourselves on what's going on with you guys and keep ourselves up to date on that. We work with state side of things. We also work with the federal side of things. Family assistance centers and family assistance specialists are a national contract, so we're national. We're not only just in Vermont, but we're in every state. So if I have somebody that's a part of the Vermont National Guard, but they don't necessarily live here, they can still contact us and we will get them connected to their family assistance specialist in their area. With that being said, we not only service the service member, but we service veterans, their family members. When they are deployed, we call them, we do welfare checks once a month. So they have somebody for support if they have any questions, you know, say it's wintertime and hey, you know, my husband's usually around and he's usually the one that does all the snow plowing or the shoveling. We do our best to get them to a resource in the community that will help them. If anybody ever, we get the question a lot, how do you know if you're a veteran? So if any one of you have a question on that, please, you know, feel free to call one of us. I do have resources in the back. It has every one of our areas with the map located on the inside with our phone numbers. We know that information. We know the criteria. That it can get a little confusing, or you know, but we know the forms. You know, DD 214 is the form we usually go by, but we do handle all branches, and we're 24/7 available. We always have our phone on, ready to go, whether it's a crisis situation, anything. We always have our phone on us. There are 6 or 8 essential tools that we provide, and a big one is enrolling in the DEERS program, which is then affiliated with the TRICARE. So we educate ourselves to the TRICARE insurance that is available for service members and veterans. A lot of the service and benefits. VA benefits. A lot of veterans don't realize that they are eligible for these benefits. So if you do get somebody and they're questioning, or they don't have insurance, or they don't have any type of, or they don't know if they're eligible, please send them our way. We can go through that criteria with them. We also utilize an emergency family assist, the EFAC operation. So if there was a state of emergency in our state SFPD were to activate that, we are ready to go. We set up a makeshift desk and we're there for the communities. I know that I assisted during the flood last year in Swanton when the Red Cross was there. We do community outreach, like we are all doing here today. Crisis intervention, we go to, like myself, I just went and I got certified through the mental health first aid. We have assist training. We keep ourselves trained yearly and do mandatory training so that we can better help our service members and families in crisis situations. Legal representation, resource and referral. We let them know where they can go for these resources. We've used restorative justice a lot. We've, gone to Department of Children and Families, Department of Labor. Financial is a big one that we assist with. Service members, they do too as well struggle like the rest of us at times. Life throws us some punches that we can't, control. And sometimes, being a service member, it's hard to accept, that there's, a fault or, we're behind in things. And then they come to us with financial issues as well. And it's our job to find them financial help, whether it's outside through the state. We have inside organizations that can help. And that's without them having to pay the money back. So what do? We do non-clinical case management. We have a system that we use through the National Guard Bureau called FMP, is where we put all our data entry and we do our case follow-up. We do start to finish. We follow up all the way to the end and leave it open if they need to come back to us for anything or any questions. So there's always follow through. Community networking, like I said before, just getting to know, getting ourselves out in the community, letting our communities know that we're here, that we're embedded in the armories, that we want to work with the community partners and we want to make things better for everybody all around in any way we can. Event support. We go out to events, we do presentations, we're there, we set up resource tables. We attend, like I said, mandatory trainings. This just gives a basic overview of what we do step by step as far as our case management goes and how we do it. And I can send this out, like I said. And it's done. So we have a time frame in which we respond to. When we get the initial call, we respond within 24 hours. If an emergency call, we respond within 1 hour, depending on the situation. Contact, we can contact by email, mail. We also have a number that you can call, 1-800 number that'll be listed later on the slide. It's through, we call it the JOP. They go through and they'll screen the call, they'll identify the severity of the call, the manner, the temperament of the person calling if they're really stressed out, and then it'll be distributed to one of us through our coordinator. So like I said before, specialists will reach out to the families during deployment. This will be done on a monthly basis. If any issues were to arise, like I said, I had somebody last year, their service member was deployed. Their heater broke down in the middle of the winter. So that's like a crisis mode. They had 4 kids. They didn't have any heat in the house. What did I do? I hurried up and I called and we got an emergency funding for that, for somebody to get right out there and help them get their heat back on. Community networking is very important. Each and every one of you, we utilize you guys a lot. Keep inviting us to things, that way we can keep bringing what you represent and bring to the table to our service members and their families. Build support for clients, new resources in the area. If you guys know some that are coming or want to share them, please reach out. We're always looking for new ideas or any way to make us better as a whole. But overall, we're good. We work through state. This is the emergency EFAC training like we did during the flooding. This just tells an overall thing of how we do that and how that is set up. A little bit more about event support. We also get service members ready for them to deploy. We set up resources. We make sure they have our information. They call them service readiness events, and they are held on drill weekends. And we can see up to, on one drill weekend, we can see up to 250 soldiers in one day. We do briefings, local, state, and federal. We give out resources at these events and hope to bring some back with us as well. This is the umbrella that we fall under. There is, like I said, Brendan Richards, he's in Colchester, myself. I'm located at the Swanton Armory, usually Monday through Friday. If I'm not, it means I'm out in the community with you guys. There's Chelsea Wells, she's located down in Burlington at the Williston Armory. There's Rita Durgan, she's located at the Berlin Armory. Deanna Ryder, she's out in Rutland. Cameron Heitman, she's way down in White River Junction. And each one of us, we handle a certain area. Like me, I have the whole northern tier, Franklin and Grand Isle, and they have areas like that. We're all spread out throughout the state. This is a basic map that shows the spread out of the areas that we cover with our names, our area of coverage. And that's it. And now I'm going to introduce you to Candace, and she's going to tell a little bit about a program that we are going to have opening and welcoming the community to the Swanton Armory this month. And here she is.
Hello. Thank you, Wendy. I've had the pleasure of being able to work with the FAC team, and Wendy came up with this really great idea about having a workshop. So Military One Source and the Family Readiness Support Team, that's the Family Readiness Team, we basically have sort of a side project, if you will, which still falls under family programs. It's called Kitchen Spoons and Combat Boots. It's a monthly webinar. Matter of fact, there's one going on today, this afternoon. I have to book it out of here after this meeting to go and prep for that. And we do these webinars to not only help educate our military community, but also educate the civilian community on, gaps in services that we might be seeing in our military community. So today's is going to be on resiliency and influence on the home front starts with you. And anybody, of course, is welcome to join. But another thing that Kitchen Spoons and Combat Boots does is that we have in-person workshops where we try to get people together because, sometimes doing those hands-on activities gets that education out there. So the next one that we're gonna have is in Wendy's neck of the woods. It's gonna be called Do Your Holiday Like a Boss. I do have more flyers over there. Ultimately, it's going to be on resiliency. I know I've used that word quite a bit, but it's going to be on how to basically cope with the holiday stress. There will be youth programming there, and there's going to be hands-on activities. We're going to be doing some really fun stuff on like cookies in a jar, basically how to repurpose your Halloween candy. So you can create some really cool cookies in a jar to give to family members or teachers so that you can help save some money. So it's kind of like a budgeting 101, kind of like a resiliency, kind of like a networking thing. And we're always open to, finding different places where we can have these workshops. We're trying to move to having at least one a quarter so that we can try to get the military community with the civilian community. So there is the information on there. If you are interested in coming or you know someone who's interested, please register so that we can make sure we have enough stuff, we have enough space. It will be at the Swanton Armory. Did I miss anything? I feel like that was kind of the whole thing. Any questions?
When is it?
Oh, right, great, yeah, thank you. It's gonna be November 16th from 11 a.m. to 2 p.m. Thank you, sorry about that.
And there's pamphlets and information from my briefing along with her flyer on the back table if anybody wants some, along with my business card.
Thank you for your time.
Thanks, Ken.
Why would you want to repurpose Halloween candy?
Why wouldn't you?
What's the deal? Just eat it.
I have questions at this.
Yes, sorry.
Do you have any idea what the population of active National Guard families are in the counties and population of National Guard planes?
I do. I was starting to work on that table yesterday. They do have that pit count. It's called a pit count. You can gather and look that information up through va.gov. They just put the 2019 information out. It does take a while to download the table, but if you go in there, if anybody's interested in that, I am more than happy to send it out. It's very interesting, and you can break it down by counties. This year, the pit count for homeless veterans in Franklin and Grand Isle, you have to keep in mind that it's only captured on a 24-hour period. So this year, I believe for 2019, it was 1 for Franklin County and 0 for Grand Isle. Myself, I know that I've worked with service members since then and worked closely with the Samaritan House and whatnot and assisting with housing and homeless for the service members, and it's more than that.
Yeah, I would, Laura, you probably have a better idea, certainly, veterans who are.
Not nearly as many as I would think.
Yeah.
I can talk to you about
Yes, yes. So it is higher than that. I just don't think it's accurately captured.
And do you actually have funds for assistance for veterans of Guard people who are homeless or have things like heating emergencies, fuel oil, so on and so forth, or do you refer out to other agencies such as ours?
We typically, if they're a service member that is not a veteran, that they're still in but they're not a veteran status, we typically go within the Guard organizations first. If they're a veteran, we have organizations that we utilize like Blue Star Mothers, War Veterans Group Association, Combat Motorcycle Vet Association, the Legion, the VFWs. There's all kinds of funding that we go to first prior to going to the state. The state we go to usually as a second option because we like to see what we can do first and then work with you guys. And I have worked with you guys many times.
Also, lastly, and your services are directed just to National Guard active duty members and veterans, not veterans from other branches of the service?
Every branch.
Oh, you do?
We're just embedded with the National Guard, but we work with every branch of service.
Being that this is a community group, what have you identified as resources that you're lacking or would like to improve?
Housing, transportation issues are number one.
Okay.
Very, very high.
And as in veterans or, service members getting to a point, what do you mean by transportation issues? To where, from where, that kind of thing?
Franklin County, Franklin County, as you know, has a very high veteran population, and a lot of it is rural and very dispersed and hard for people to get out to the Montgomerys and the Richfords of the world. We used to be able to provide transportation through our veteran outreach program, but they no longer allow us to do that. So it's hard now, and they did a lot of the transportation to bring them down to the White River VA for medical services.
appointments.
Now we have nobody. We have very little options.
Right,
So a lot of them are just choosing not to go
right,
because they can't get there, they can't get to the store, they can't, go to the pharmacy to get their medication.
right. And then housing for these.
Housing is a major issue, because you have your older veteran population, and as you know, senior housing as it is, very scarce and far between. Just housing in general, there's very lack of that, and if you're a single veteran, it's hard to fall under the right criteria to get a single person that's in need of housing versus somebody that has 4 or 5 kids. You know what I mean?
Right,
So,
okay, so resources around
yeah.
Yeah, it used to be that volunteers through the Legion would take people down to, this is my understanding anyway, to White River Junction or something like that. You say that program's no longer sanctioned? Or?
I believe that they will still assist for that. I myself haven't utilized them. There is programs like around here. We utilize CIDR a lot for out in the island area. There's very few. AgeWell will help out with things. They'll go right to their house and stuff, so to help with applications. If they can't get out to fill out an application for the state or, to reapply for their benefits, they'll go to their house and send an intake person and do that with them.
That is a good idea though,
Yeah.
like with, coordinating with the
Yeah, I thought
Legion
there
who
was
are our
a pretty
service.
active program.
Right.
Maybe Al remembers something about that.
There definitely is a program, the problem is it's volunteer.
I'm sorry?
There is a program with VFW and American Legion. Problem is it's volunteer, and
Right.
it's on when people have time to do it.
Yeah.
So that may not correlate with people who have,
What the needs is.
Yeah.
And
So
he-
that's the issue with it.
But I'm a veteran of
Yeah.
the Cold War, and I think what you need to do is to get back out to the VFW and to the American Legion and to the combat vets of Vietnam, and just remind them that you exist and the help that you need. Because as veterans, we are willing to help one another. The other thing, other side of the coin that I'd like to mention is that veterans, contribute, our volunteers, both now new veterans since are volunteers, they like to volunteer in the community. And they help Vermont Rise with the kids walking to school on Thursdays, I think, right, Jessica?
It hasn't happened yet, but
Okay, but they're
willing.
They're willing. The other thing is that we also volunteer at the hospital. And the hospital, it's a supportive community. Right now, most of us are Vietnam-era veterans, and we're looking for younger veterans. But we meet 4 times a year as a team. We're there every week, but we meet as a team. And you'd be surprised how we can help one another, how we support one another. And I would invite veterans that you're serving, and also the spouses of veterans, if they want, when their husband or wife is deployed, they can also be valets at the hospital. And we provide that emotional support, that friendship, what have you. So I would think, 1, help us understand more what you need, and 2, help and make the veterans now and the actual service National Guard people know where there are other opportunities to volunteer in their free time, because we do, like by virtue of our service, want to get out in the community.
Yes, and I will definitely bring that to the table, and if you want to invite us to the next meeting, I'll be glad to go to it.
Okay. I mean, of the hospital or?
The quarterly meeting.
Your volunteer
Yep.
meeting.
Okay. The person you want to contact is Catherine Winchester at Northwest Medical Center. She's a volunteer chief.
Okay, perfect, thank you.
You're welcome.
Have you heard about the Formidable Four community forums that are coming up or happening? This is an initiative that I think grew out of the local workforce investment board and Kathy LaVoie's work, and I think has moved over to the United Way now, has taken over that. So the Formidable Four, identifying the four biggest barriers to employment in the community, which are housing, like you said, transportation, like you said, as well as childcare
Yes, that's
and
a big
recovery and substance abuse. So I think these are four issues that cut across all populations and affect all four populations, not just veterans. So I
Yes.
encourage you to reach out to the United Way and find out when those forums are gonna be, so you can bring the concerns that specifically affect veterans populations to the table as we talk about the entire scope of the impact of these problems
That's a great
on the
idea.
community.
And you just reminded me of another big problem is the childcare, but I think that's all around. A lot of service members have a hard time finding people to watch their children, especially during the drill weekends, when they're mandated to be at training. A lot of daycares aren't open on the weekends. I myself have been putting it out there to community members and community daycares that are registered, asking, are you willing to be open during these times? Because I have service members that are, in need of that, so they can go do their trainings. But if you guys have any suggestions.
Groups would be a good thing to tap into, so open weekends and have services.
Thanks for bringing up the Formidable Four, because that allows me to just put a quick plug in that we are helping to coordinate an application for Franklin and potentially Grand Isle County too, through the Working Communities Challenge through the Boston Federal Reserve Bank, to look at the Formidable Four and figure out where those points of action are that we can take to make some progress on improving housing, childcare, transportation, and substance use issues in the region. So if anybody is not already on the partner list, come see me after and we'll add you.
Just one more thing, the St. Albans Town Select Board is in the process of passing a new ordinance to extend daycare throughout the town. So we do know of 2 new facilities that are going to be opened up once that ordinance passes and they can get their business plans together. So we are trying to address that in the community.
Any other questions?
John? Are you kind of on the really mundane side compared to some of the other questions? When you set up your normal family assistance centers, you operate out of the armories. When you set up an emergency center, do you always set it up in an armory, or would you, depending on the community, if there's a community specific area that you need to serve that doesn't have an armory, are you prepared to set up outside of an armory?
Yes, for instance, when they had the flood last year in West Swanton, they set up at the town municipal building in Swanton, and we were there with them. We set up our resources, we were there the whole time, so. We go wherever the disaster is.
Through the multi-agency resource center, right?
Yes.
The mark.
Yeah.
So they create a mark after, they set up a mark after Swanton. And then I think that's what you're talking about with a lot of
Yes.
other agencies, yeah.
Yeah.
Very good.
You want to address, I'm sorry to interrupt so much, but you want to address the National Guard now is going to have a major deployment next year.
Correct.
And I assume that you're planning for it, but how might we help you in that major deployment that's coming up?
Good question. You wanna jump in?
Well, definitely, pretty much what you guys are doing now, just, be there for the families. I don't know, that's I could say,
If I could speak up,
Yeah.
so the family readiness groups, which are the groups that are basically every commander of each unit is mandated to have a family readiness group. It's a group of volunteers and service members, community partners that help support that unit specifically. We're definitely finding that it's been difficult to, one, get volunteers to come, and we have people on paper, but we don't necessarily have people who are like really, they're in the trenches, if you will, supporting these families. And then the other thing is that when we do have individuals who are supporting the families, they're getting burnt out really quickly. And so I think just being able to provide the education to them on how to make sure that they're maintaining their own, well, I guess self-health is what you could call it, putting themselves first before you put someone else, help someone else is helpful, but also just getting that network of volunteers together so that we can kind of make sure we're rotating and not burning anybody out. Oh. Yes?
One of the organizing principles of this program was its expansion during deployments and its expansion during civilian crises. So that built into this organization are all the mechanisms. I started this back in 1988, and built into it was the ability to expand very rapidly from the unit level, and then when the crisis is over, to shrink again.
So during the deployment, there will be more of us added, because obviously 6 of us throughout the state can't take care of a whole army, and their families that are going to be gone. So they will be upping the number of us to be able to handle that population being gone.
Will there be a family readiness group for Franklin County?
There is one currently. So there's a fairly quasi-active one out of the Swanton Armory. The FRG leader there is Tiffany Degree. And right now, Captain Smith's wife at the St. Albans Armory is the one who's leading up. Jessica Smith, I believe, is her name. But for the most part, it's those gals, and that's it. And they're, so getting them a little support, I think would be beneficial. So yes, we do have them. We just think they could use a little
more manpower.
Yeah. Or woman power.
Does anybody do anything do they do anything out of the Enosburg Armory?
I would have to go back to my records, but I don't think so. I don't think there's anybody with the Enosburg Armory right now.
No, there's not.
Okay, thank you.
What kind of tasks are the volunteers that are involved in this tasked with? Like what kind of jobs?
Yeah, sure. So every FRG needs to have a leader, and so the leader is required to take, at present, is required to take like a 90-minute training with me or with the my other FRSA. And they're expected to basically be in communication with the Readiness NCO, non-commissioned officer for anyone who doesn't know what that means, and as well as the commander. Since ultimately the Family Readiness Group is the commander's program, it's kind of up to the commander as to what that's going to look like. State mandates that there needs to be at least one family event, so that the families can be updated at least annually on things that are going on with the unit, community partners and stuff like that. And I fully expect, however, with an upcoming deployment, units that will be affected will be having meetings and events more often. I don't know if that answered your question.
Normally with the yellow ribbon, right?
I'm sorry?
Normally in conjunction with the yellow ribbon event, the family will have a meeting prior to that.
That has not been my experience.
Okay.
No, ma'am. It's separate. But I don't know if that answered your question as to what it was they were expected to do. It's a little bit of everything. Ultimately, the FRG leader is just meant to be this part of this trifecta, if you will, with the commander and the Readiness NCO to make sure that families are being informed of what's going on, and to sort of do a weather check with them to see if there's issues within the unit. Yeah, if they're finding there's a lot of marital issues, then they would hopefully get that information and be able to give them, to the fax or to someone else who might have a resource. If it's budgeting, they might have us come in and do a budgeting 101, or we might have our personal financial counselor come in and do a budgeting 101. It's kind of the individual who would sort of keep a pulse on what's going on with the families.
So, excuse me, but are you saying that the family readiness group leader or whatever would need to be a veteran or part of
ma'am.
a unit or a civilian? Are you
No,
looking for
ma'am.
civilian volunteers?
Yeah, so if they can be a veteran, they just cannot be a deployable service member. That's kind of the one criteria that they have. Pretty much anybody outside of that criteria, as long as the commander trusts them and thinks that they're capable of helping support his or her vision, then yeah.
And there's a commander in charge of every armory.
I have two questions. One, do you have, I think of like, kids who take consumer science, they like, how do you do a checkbook and cooking and ironing and stuff, but do you have that sort of planning for families as they're going to deploy, like, how do you figure out your finances, or how, do you have your registration? What,
Yep.
okay, do you
Yeah.
have sort of like that plan? And then my second one is, what constitutes a veteran? So,
Okay, so, good question. I'll answer your second one first. A veteran is categorized as a former member of the armed forces of the, I wrote this down because I want to get it exact, is a former member of the armed forces of the United States of all branches. And it is when their discharge criteria is listed other than dishonorable? Other than dishonorable. And it doesn't matter how many active duty days, it could be one, and they got hurt and they're out. They got honorably discharged. They're still considered a veteran. A lot of veterans don't know they're veterans.
well, that's what I was
So
asking.
that's why it's best to just, because there's many different criteria that they could fall under, and it's best, we know the form that you look at, DD 214 is the name of the form, so we look at that and go by that.
So, and quite a few years ago, there was a lot of discussion about the DD 214s and that they weren't getting filled out, or they didn't have paperwork, or lots of stuff got lost. But is it safe to say that, in general, as someone who's not spending a lot of, well, I don't have your job, but that would someone know if they have a dishonorable discharge? Would that be pretty obvious?
Yeah.
And if you don't have that,
They
then
would
it
know.
would be, okay.
But sometimes they get confused, so it's
Okay.
better
To
for
just
one of
pass it
us
on.
to tell them
Okay.
versus you saying, well, you're not a veteran.
No, I would go on, but.
So,
You can send in to the National Archives to get your DD 214 if they don't have one.
yeah, but we have ways to get them.
Yeah.
Right.
And there's a category that is other than honorable, which
Yes.
is not dishonorable. So
Right.
somebody who's got an other than honorable discharge may think they're not a veteran because they don't have an honorable
Right.
discharge.
Right. I mean, I just think of, perhaps folks who had an emerging significant psychiatric illness.
Yeah.
Right.
Yeah.
And just to touch base on that, there are people, so a great example is there were people who were put in as dishonorably discharged due to, being found out that they were homosexual. Those are being changed.
Yeah.
They can go back. So they might have originally had a dishonorable discharge and they can go back and get it changed due to changes that have happened within legislation.
Oh, super, thanks.
Oh, and did I answer your other question? What was it again? Oh, yes, you asked if we have if we prepare them financially. We do have, like I said, under the family programs umbrella, financial counseling, free of service, budgeting, everything that goes with a financial counselor falls under that, and it is free of charge. She will go to them. She also does briefings at every event, yellow ribbons, she's at the events. She does breakout sessions, she'll go to you. We also have on mental health counselors in general for the family and service members that will go right to you as well. Substance abuse counselors, we have them there free of charge, and they're excellent. They come, they educate, they're there at every event in time of crisis and need. What else?
And they also, anybody who's dealing with a deployment, service members are mandated to go to something called Yellow Ribbon. I don't know if everybody knows that, but it's basically usually a day event, sometimes a day and a half event, where there's education for the service members specific about the deployment, things that might affect them, like budgeting, your pay's gonna change if you're deployed, who's gonna be paying your bills, things of this nature. Families are highly encouraged to go to those, however, we can't mandate families to go to those, so therefore that would be another opportunity for them to get that type of
Yeah, and if they're
education.
getting a disability benefit and they're gonna get deployed, there's things they need to know as well, as far as they call it double dipping, they can't double dip, so they have to stop that. And then when they go overseas, otherwise they'll be penalized for that. Certain things that they do educate on, yeah.
Did that answer the question? Okay, great.
I know at one time there was some confusion over members of the U.S. Health Services were at one point considered veterans, the way I understood it.
They still are.
A member of the armed forces, but they were considered veterans for certain purposes. Is that true or not?
Members of the public health service are veterans, and they are eligible for all services. Jessica Frost's husband is a member of the public
That
health.
would be someone that really doesn't know whether they're a veteran, maybe, or could be, because a lot of people are confused about that.
Yeah, and
You're
I
a
mean,
member of the-
I can definitely get a more accurate answer to that question for you and get your information and send you that, because I am not fully educated on that myself.
Yeah, I mean, like, people that have gone through, like, they're a doctor, gone through, and their education was paid for by the American Health Services Organization. I believe they have a DD 214 or something similar anyway to it. Okay.
Okay, I will find that information out for you.
Okay, any other questions? Well, this was a great discussion, and again, thank you very much, Wendy. Now, we're going to move into the organization sharing any new initiatives, upcoming events, that sort of thing. But before we start around the room and what have you, I know Scott wanted to make an announcement and just make sure that everybody was aware of a certain initiative. So Scott, if you'd like to go first.
Thank you. So part of my role as in the health department is organizing our medical reserve corps volunteer group. And they're kind of tasked with emergency response, public health outreach. Part of what they've been doing in the last couple of years has been going to Martha's Kitchen on a weekly basis and providing a health clinic, just checking in on blood pressures, glucose checks, wellness checks, general, making sure that the client at Martha's are cared for. As part of that, they started having a discussion amongst themselves, brought me into it, and we started having a discussion about trying to find ways to bridge service gaps for individuals that either go to Martha's or are homeless or are, vulnerable population type service. So part of the initiative that we came up with was, let's have a roundtable type discussion with service providers. It's open to the public. We are having this Friday at the St. Albans Museum. And I think a handful of folks that are in here are going to help participate in that. I have flyers if anybody's interested in attending who doesn't already know about it. And we will be looking to not only have like a roundtable type discussion of services that are provided by service providers, but also have members of the public that are available to ask questions. We also put together type self-care kits to hand out to those populations as well. So I just wanted to open it up and allow people to come. It's open to the public. We're going to have it starting at 9 o'clock. It's going to be in the Bliss Room at the museum. And feel free to just show. Hopefully, we'll see how this goes and possibly have this as an annual event, depending on how well received it goes. And I think the MRC is definitely interested in helping out and bridging these gaps in the community.
Who's sponsoring this event?
So it's the Northwest Vermont Medical Reserve Corps. The Medical Reserve Corps, the volunteer group.
Can you describe a little bit about what the Reserve Corps is?
The Medical Reserve Corps is the volunteer group that is part of, underneath the health department umbrella, but they're an independent volunteer group that responds to public health emergencies, public health outreach, trainings, clinics, those sorts of things.
Thank you.
Scott, you mentioned going to Martha's Kitchen. The third Tuesday of the month, I have a captive audience of usually in between 60 and 100 people, most of whom would fall in the category of being vulnerable because they're coming to get food at my food shelf. And on several occasions, we've had other people, we've had people from the Department of Health, we've had people from Community Action have come as an opportunity to interact with those people because they often sit and, they're sitting and waiting while we're distributing food. And that, I'd like to maybe talk to you about, there might be a chance for your people to come and be there. There would be plenty of space even before we get our new building built. We still operate out of the church right now, but would be an opportunity maybe for them to see, to see people. I'll talk to you about that.
Yeah, absolutely. I think I welcome that. I think a whole bunch of the volunteers would as well. Absolutely.
Any other questions for Scott on that? Mary Ellen? No? Any question, gentlemen?
An announcement.
Okay, thank you, Scott.
Thank you. I appreciate it.
Yes.
Can I go?
Yes.
I just want folks to know that if you know anybody who's suffered damages from the storm on Halloween or the weekend after, please let them know to call 211 to report their damages. We're trying to collect the damages and get it to the state so that they can potentially look at a federal declaration for individual assistance. And this is quite an area that was impacted. So please, if you know anybody who was impacted, have them call 211. Even if they've already put their house back together or mucked out their basement, have them call anyway so we could get that on record. Thank you. But unfortunately, between 8 a.m. and 8 p.m. Monday through Friday. Thank you, Joe.
Yeah, sure. Yeah. Other announcements that people may have, would you like to share? Michelle?
I just wanted to let everyone know that with our new websites for the Messenger and the Milton Independent, you can now post events yourself, so you don't have to go through us. So if you're holding an event that you would like to invite the community to, you can register it. You just register on our website and then you can post all of your events, you can edit them. If something's monthly or weekly, you can set it up so that it appears all the time, and that's where we take the events that we're going to put in the paper from. So you can control it, you can put a photo up, there's a lot of options, so I would encourage people to take advantage of that. And if you're booking things ahead of time and you want to know, is somebody else scheduling something for that weekend? As people put things on that are happening in the future, then you'll be able to kind of avoid conflicting events. And so the rec department has already put all their events on through early 2020. So if you want to know, am I going to conflict with a rec department event? You can go and take a look.
That's
sure. Yeah. Hopefully it'll be really useful for people. I'm excited about it.
I think one of the things that happens is that sometimes people may send something to the messenger, but maybe it's late in the game or whatever. This is nice that you can plan ahead when you know something is going to be coming up in several months or what have you, and ensure that information is there. That's great, Michelle.
Yeah. And people can look at it too instead of just at what's happening this week.
Yeah.
The Northwest Regional Planning Commission is hosting a community engagement
workshop with a community engagement specialist, Rebecca Sanbornstone, on November 21st from 6 to 8 p.m. It's at the hospital in the Green Mountain Conference Room. I have flyers. You can RSVP to me or just come up to me after the meeting. But basically, it's going to be focused on new and innovative ways of getting community members involved in thinking about planning for their community, what they can do to make their community more active, especially with local government, but also just planning for community activities.
I just want to make, Deb, before you go, make sure that, I don't know where the sign-up sheet is, but making sure everybody does sign in.
I have it here.
Oh, okay, that's good. The other thing I did want to mention is that the entire presentation that Wendy made, as well as the flyer on the event, will be in the weekly updates, just so people know. So you'll be able to view that at any time. So Deb, yeah.
Two things. Eric, you left, so I was going to take both, so that's okay. But Northern Lights, so CCB is having as groundbreaking on let's see, tomorrow at 4 o'clock in a new building. We're going to, cut the ribbon, dig the hole, whatever. So bring your shovels. No, just kidding. So our groundbreaking event for our new CCB building will be at the corner of Congress and Main, right? And Bank, yeah, right in there. That new
Main.
Congress and Main. Congress and Main, yeah. So anyway, so that's exciting. We're gonna have a new building maybe in a year to go to for CCB. And other community, I'm not exactly clear who else is gonna be in the building, but a couple other community partners, so that will be awesome. And as far as the bookmobile, we've hired someone, she's ready to roll in a couple of weeks, so the board is targeting early spring to get Figgy back out on the road, so.
All right. I like how you said ready to roll.
Ready to roll. I haven't lost it quite yet. Yeah, so, yeah, our goal is like Tim Smith will tell you, our goal as a board is to have people say, Deb, who's that?
No, that will be legendary for the next 100 years.
No, the bookmobile, we're gonna have a fleet, so.
I have a quick one. So this was, I had touched on it quickly earlier, but the community addiction workshops, we're gonna be getting the flyers out before the next community, or the next updates that Joe sends out weekly. And what we're gonna be touching on is a combination of understanding the body and brain changes that happen with addiction. Why can't addicts just say no? How can individual community members help in the fight against addiction? What it is like living with an addiction, and then how do Narcan and naloxone overdose kits work? We also have new, what they're calling HRP, which is a harm reduction packs that I just got a shipment of not too long ago, and I'm gonna have as much as we need. I've already connected with the health department of those kits. And in those kits, it's not just the Narcan kit, but it includes gloves, it includes lip balm, just a lot more education on Hep C, HIV, how the Narcan works on addiction. So at this workshop, it's gonna be starting Tuesday, February 12th. It's gonna be at the Swanton Episcopal Church, and it's gonna be a bi-weekly workshop, and people can join anytime, leave anytime, do the whole series. But it's gonna be a real comprehensive opportunity for a person who may not struggle with addiction to step in the shoes of somebody who does struggle and kind of experience what they go through. We're gonna have some infusions throughout the 2-week span where myself or one other person will contact an individual and say, okay, you were ex-patient, but this week you got a notice that you're being evicted. How are you gonna handle it? Things like that to help people really understand how it feels and what a person goes through under struggling with addiction. So that starts February 4th. We're gonna get the flyers out weekly by the end of this week.
Now, is that something that you are certifying people for going or giving a certificate at the end of completion, or just out for awareness?
It's for awareness.
Okay.
And I mean, people will get, as far as like the addiction or the naloxone kits, they're gonna get the kits and the training for it. But this is an education for families and people struggling or people interested.
Okay. And you're gonna put that out in flyers or?
Yeah, so it's gonna be in flyers. Our team has connected with Northwest Access TV, with the Messenger, with the County Courier, with 7 Days. It's gonna be pretty widely spread over the next month. So the word will get out. There's gonna be flyers that are gonna be physically posted up at a lot of quick stop stores. And then we'll also have it in the partnership update emails.
Thanks.
Yep.
Everybody remember next next meeting is our annual meeting with legislators.
Yep.
So I'll be sending out an email invite to all of our legislative delegation. And so everybody plan to come. That meeting usually is pretty well attended. So come early to make sure you get a seat.
And, Amy, it's the what?
It's the cookie meeting.
Yes, the cookie meeting. She's the bag lady,
That was not
she's the
my
bake lady,
announcement,
she's the cookie lady.
Keep your arm up. Yeah,
Okay.
okay.
Are you calling?
Keep your arm up.
You're up.
Okay, speaking of addictions, the third Thursday in November is traditionally the Great American Smokeout. And although it's not a formal, like, here's how you participate in it, it's a really good reminder that people who do use tobacco or nicotine-containing products often are thinking about quitting. The Great American Smokeout is just an opportunity to remind folks that there's great resources out there and to help connect them with those. And that blends into the quit for the holidays and quit for the new year. So kind of November, December are really times when we can probably successfully encourage people and support people and make that quit attempt. And there's great resources in Vermont to help them to do that. Crystal.
I just want to tag on to Amy's, that if you're dealing with any clients that are vaping and they actively do want to stop using, they can drop their devices or the cartridges in any of the medication take-back boxes that are located throughout the community. We have them in the hospital, we have them at the Vermont State Police Barracks, the St. Albans Police Department. Swanton Police Department will also take medications during normal business hours. So they are able to get rid of those safely and get them out of the home as well. And then my second was an announcement that we are offering the drug information training for education professionals on the 18th and 19th of this month along with Vermont State Police and the Essex Police Department. Anyone really that is working with youth that just wants to understand what impairment looks like is more than welcome to join us. If you want to just attend the first day, that's really the day that we start looking at what impairment looks like for a young person.
When is it?
It is November 18th and 19th. They are full day, 8:30 to 4:30. It's free of charge. And it's right here at the Vermont State Police Barracks, and they can just email me for registration info.
One thing that we're looking, I guess, so I have a committee for the American Cancer Society here in Franklin County, and our next meeting is on November 13th. Two of our goals that we set at last month's meeting is that we want to try to make sure that we're being more impactful and more resourceful to survivors and caregivers throughout Franklin and Grand Isle County. And so we're looking for either someone to join the committee to help us with that, or just join one of our meetings to share their opinions on how we can do that. We also are trying to reach out more to youth in case they themselves have gone through a cancer journey or have a family member that they're caregiving to. I've been fortunate, some people in this room, that we've connected with some students in Franklin County, but we are definitely looking to connect with more if there's opportunities to hear from them and find out the best way to share information for them. So if anyone's interested, our next meeting is Wednesday, November 13th. We're meeting at the Foundry in the side room. We've got it reserved. We're also going to be taking time before the meeting to create a wreath, which we're going to be donating to a Festival of Trees, which benefits Martha's Kitchen. So if anybody has any purple decorations, pom-poms, glitter, and you want to come help us make a wreath, we'll be doing that before the meeting.
Just want to put a plug out there. Thursdays, Turning Point has an office in Enosburg now. So for anybody who has friends, family, clients needing recovery help in the Enosburg area, we know transportation is an issue. We have an AA, we have a 12-step group at noon, and we have a more cognitive-based group at 10, and they can drop in at any hours between 10 and 4:30 on Thursdays. It's at the Enosburg Community Center.
Can you say?
Yeah, so we are about 5 months out from the annual Career and Job Expo, which sounds like a long way out, but especially now that last year was the first year we did not have a paid staff person working on that endeavor, and it was all volunteer. It's really a pretty big, heavy lift. Katie Coe has graciously agreed to step up and be our fearless leader again. I'm not sure why she wants that level of pain, but bless her for doing that. So she sent out an email yesterday, a doodle poll for what's going to be our first meeting of the season to get rolling on that. the more hands on deck we get, the easier or the lighter a lift it's gonna be for everybody involved, so we would appreciate the help and support. If you're interested in being a part of the planning of that, I guess send me an email and I'll have Katie send you out a doodle poll invite. My email is in the big thing here, Eric Peterson.
Where are you having that?
Not sure yet. In the past, it had been done up at the complex, Mount Pearly. That became a little cost prohibitive for us, so last year it was actually moved down to City Hall and went pretty well at City Hall, but again, these are big questions, like where are we gonna do it this year, and we kind of make it up from scratch every year.
What month do you think you'd be having that?
Boy, you're putting me on that. I was trying to March. Yeah.
Because I was thinking about doing a resource fair myself, so maybe we could collaborate on that.
Yeah, and so, I know last year it was a movement away from resources and more specific to hiring.
Well, yeah, that's what I mean.
To hiring companies.
Yeah.
That being said, I think there's lots of opportunity for integration with you guys and with all the different resources that we look to include.
So Al just left, I was gonna invite him to jump in, but I have a question more from a municipal level, so I'm on the town select board with Al. And we're going through our budget season, and the select board's looking at how much we spend on police services. And we spend a lot, and policing's very important, but we haven't really seen a decrease in the amount of crime or drug-related crime that's going on. So it's leading to conversations, what else can we invest in to stop people from using or to give them alternative pathways to deal with their addictions. So, what comes to mind is Mary and your Building Flourishing Communities presentation and NRPC and the municipal primer that you guys put together. And I'm sure other people have ideas, but if there's anybody who is willing to come to a select board meeting, have some concrete ideas and examples of what other communities have invested in and what the rate of return, I guess, on those investments are, be very much welcome.
I'd say Amy and I are happy to come down and do a presentation about upstream prevention and working with youth before they get to the point of dealing with substance use or addiction.
Yeah, because you look at the numbers, many of you in your organizations came and asked the town for money, and it's such small amounts versus what we're investing in policing. And policing's really you guys know, it's the tail end, there's so many steps in between.
Some of it's really cultural shift and changing those cultural norms so that they are, so upstream prevention works. It's really difficult to work on upstream prevention with youth if we're sponsoring large family events with alcohol industries. So that would be really helpful to get local select boards behind kind of changing policy and helping us to create that shift.
Well, I just want to say thank you to St. Albans Town too for being a visionary in terms of they've supported the bookmobile for a very long time, and it's been, that's one of the small prevention efforts at the early years that can make a difference. And so supporting childcare providers in that way and families that can't access their library is a good step too. There's $7 payback on one. There's all kinds of research, so yeah.
Oh, I should put that in the pitch. This is why you don't want me going in.
Oh yeah, that should have been.
I have some advice for you as far as your children. You should adopt one of my goals in life, which is make sure you live long enough to become a burden to your children.
I'm trying.
Yeah, we can talk after.
Gina,
my question.
Why do we have to wait till we're old to be a burden on?
I just said live long enough. You can decide how long you need to live to have.
So the Strengthening Working Families Initiative, or SWIFI, is a program that sponsors parents to train for a career in manufacturing. So if anyone knows a parent who's interested in training for a career in manufacturing, I'd love to talk to you, or your staff who also works with people who might be interested. So I'd love to reach out to you all to And my name is Gina, I'm from Blitz. Talk to you soon.
Any other, no? Okay, well, thank you everyone again for being here this morning. As John said, we're gonna reconvene on December the 4th for our annual meeting. Amy, there will be cookies, you're going to bake some, I believe.
I will bake some.
And others, it's kind of a potluck, and it's also an opportunity to engage with the legislators before they go into session. As you know, we invite them, all of them, they're always welcome to come to the meeting. As you know, there are those who attend. But they know that in December and June, we like to have conversation with them about particular advancements or things that might be hitting roadblocks as far as initiatives are concerned. So we will reconvene on December the 4th. Again, thank you everybody for being here this morning. Have a happy Thanksgiving and we'll see you in December. Thank you.